Currently, RSV is one of the leading causes of respiratory tract infections, and that leads to hospitalizations among children who are under 5 years of age. And globally, this has been causing about 33 million cases of acute respiratory infections in this age group, and about 98% there occurs in developing countries. In the Kenyan context, RSV occurs in seasons. So like at the coast, we experience RSV epidemics from November to around April there. And it's during those times when we experience a lot of hospitalizations of children in our wards here. And if they are tested, then about 30% of those who are admitted with either pneumonia or very severe pneumonia, they are found to have RSV infection as a cause of that hospitalization. Because of this huge burden, there's been a lot of efforts to have interventions like vaccines that can prevent disease. So at the moment, there are 2 interventions that have been found promising. One of these interventions is a maternal vaccine. So the maternal vaccine is going to prevent disease in children, but it's being given to mothers, so when they are pregnant, and so that when these children are born, then they are born with a high level of immunity against RSV that can protect them during the time when they are most at risk. Then the other intervention is a monoclonal antibody, which is supposed to or targets these infants at birth, or as we approach the RSV epidemic. For the policymakers or even for the government to be guided or to have information that can guide them to implement these interventions, there was need for data, especially on the health burden and on the economic burden. And then now, because of the interventions that are there, there was need for data on the cost effectiveness of these interventions. So the issue that has been released by BMC Medicine has published this work, and most of this comes from Kenya. Most of the data comes from Kenya. The health burden for RSV has been shown to be very high. So annually we have 85,000 cases of severe acute respiratory infections that are either hospitalized or not hospitalized. That is caused by respiratory syncytial virus. Introduction of these interventions in this setting will be cost effective. Like for instance, if the maternal vaccine per dose will cost about $5, then it's going to be very cost effective for both the government and even for the households, because we from the research we've been conducting here, at least a household has to part with about $172 if they have their child hospitalized with RSV infection. So this data is timely and it's going to give way forward for decision making and prioritization of of these interventions for settings that they are most required.